Hi, this is Just Be Well, the channel about whole life wellness. I'm Tom Sult, a medical doctor and functional medicine practitioner.
I'm Elizabeth, a registered nurse and life coach.
We've been hiking in the woods and canoeing on the lake, and I just noticed that you got some kind of stuff in your hair. There we go.
Stuff I can deal with.
It wasn't a bug. It wasn't a bug. But bugs. So we are kind of thinking about Lyme disease, and wanted to talk a little bit about Lyme disease. And oh, hi, Fran.
Hi, Fran.
And what Lyme disease is, and what it isn't, and how you might go about finding a comprehensive strategy to help you feel better. So Lyme disease is caused by a bug of the variety Borrelia. Borrelia is a spirochete. It's a kind of bacteria. Looks like a corkscrew, but it can have other forms as well. And there are a number of Borrelia that can cause Lyme or Lyme-like symptoms. So it's not just Borrelia burgdorferi. There are many others. So that makes it a little challenging because often hi Bridget.
Hi, Bridget.
Often the tests are just for Borrelia burgdorferi. So it's important to be careful. There's two groups of doctors and scientists involved in Lyme disease. There's the Infectious Disease Society of America. That's the dominant big group, and they say that acute Lyme disease exists, but chronic Lyme disease, or this thing that's called chronic Lyme disease, doesn't exist. And when they say doesn't exist, they mean that it's not an ongoing infection. And they may not be wrong about that. I don't know, and I don't really care. What I care about is that everybody acknowledges that there is a large group of people who are chronically ill after getting Lyme disease. And so it's important to simply take those people's experience seriously and try to help them feel better. So, I understand you had Lyme disease.
Yes, I struggled with Lyme disease, even though
Did you even know you had Lyme disease?
I did not know I had Lyme disease. I went to many different doctors with a variety of symptoms, and every doctor that I saw, everything checked out and was fine, but yet I was still left with all of these lingering symptoms that I had no idea what was causing them.
How long?
This happened over a decade, so a 10-year period where I did many things to help control my symptoms. I didn't take prescriptions or anything like that, but I did do a lot of dietary and lifestyle changes along the way that I feel really helped me in maintaining the amount of day-to-day activities that I was able to maintain over that 10-year period.
So when did you start your special diet, and what was that diet?
Well, I've always been a little bit concerned about what goes in my food.
Me too.
When I was 20 years old, a physician told me that I had osteosarcoma, and it was just like there was a light that switched on inside of me, and from that point forward, I became aware of everything from the things that are, ooh, there's a bee.
Yeah, and he's going in the house.
No, he's on your arm. Door shut.
No.
Okay. So, there's a bee. Okay, sorry.
Are we still with you guys? It looks like we're still live. Yeah, we just had a little fluctuation in our internet for some reason. The bee must have taken the internet.
Yeah. So I've always been somewhat aware of what's in my diet and paying attention to the food that goes on our plates. But I would say probably 6-7 years ago, I went on what's called a real food diet. So I wasn't eating anything and wasn't feeding my family anything that had more than 5 ingredients in it. And if it had more than 5 ingredients in it, I was making it. So I did this over a year period, and actually I watched.
Think Little Home on the Prairie, Little House on the Prairie.
Yep. I was making a lot of things. And, you know, our family's health did improve significantly just from that real food diet. And, you know, because even the health foods that we put in our bodies, if you turn it around and actually look at the ingredients, there are a lot of things in there that are hidden that if you don't know what it is or you can't pronounce it, you know, why would we think that our bodies know what to do with it?
Yeah.
So, you know, between the diet and lifestyle changes that I made, I was able to keep my symptoms somewhat at bay. Now, I did still struggle with fatigue, and I had muscle aches, joint pain, foot pain, palpitations, vertigo. I would sometimes get vertigo. There's periods I had it for weeks at a time, and I would be bedridden because the vertigo was so bad. I had to go to the bathroom and like touch my hands down the walls just to make it to the bathroom. But I do largely credit my awareness of lifestyle in realizing that food plays such a big role in our health, because I think that there's a lot of people out there that don't realize how much of a crucial role that all of these lifestyle factors are.
Absolutely. So you're sick for like a decade, and you're an RN. So you were working nights or something, weren't you? Or how are you struggling through that?
Yeah, I started off working. I was working nights when my symptoms, or rotating shifts when my symptoms started, in mainly nights, which brings in a level of do I just have fatigue because I work the night shift? You know, there's always things that we can blame these symptoms on. You know, my muscle pain, well, maybe I did too much. Joint pain, well, you know, it must have been that box I was lifting. Or, you know, I'm not sleeping well because I'm working the night shift, so that's why I'm so tired all the time and I can't do anything. So I slowly switched to, you know, trying to change my job. Maybe if I worked a daytime job, and I got a daytime nursing job at a surgery center. And then eventually I ended up digging really into functional medicine along the way. And then I found Dr.Sult, who happened to have a business in the same town that I lived in. So, yeah, there was just...
So tell us about how you slowly thought maybe this is Lyme disease.
It was my first day working as Dr. Salt's medical scribe that all these people were coming in with all these symptoms, and I went home and I was like, oh my gosh, I think I have this. And, you know, I remember rattling off the symptoms to my husband at the time, and he was like, yeah, I think you're on to something. So, and unfortunately, my journey went to where I started treatment. I got a lot worse, and then I couldn't work any longer. But
she quit.
Yep, I had to quit.
So this long journey, like a decade of being sick. This is so common in Lyme disease. You know, around here, 30% of the ticks carry Lyme, and in northern Minnesota, 60% of the ticks carry Lyme. And unfortunately, it is such a politicized illness that even if you come in with the classic bullseye rash, so the classic rash of Lyme disease is a bullseye. And it's not just where you got, a lot of people think you get bit right here and you get a ring around it. That's not it. You get bit right here, you can have a bullseye rash any place. And you can get all these bullseyes everywhere. You can get them all over the place.
Yeah.
And unfortunately, it's so politicized that the CDC, the Center for Disease Control, says, and the Infectious Disease Society of America says, and I forgot to mention the other group, the International Lyme and Associated Disease Society all agree that if you have a bullseye rash, that's all you need to say that's Lyme disease, it should be treated. And, you know, if doctors recognized that and just treated that acute case, life would be a lot better for all these poor souls who, you know, get chronic Lyme disease. Now, it's also true that some people who are treated with an appropriate course of antibiotic go on to get chronic Lyme anyway, but more people would not suffer from chronic Lyme. So if you have a bullseye rash, that's Lyme disease, and it should be treated with antibiotics, or if you're not into antibiotics, some way you choose to treat it immediately. Now, unfortunately, because of the political climate of Lyme disease, people will come to the doctor, they'll have a bullseye rash, the doctor will say, I don't know what that is, we'll get a Lyme test. The Lyme test will come back negative because when you have the rash, it's too early for the Lyme test to be positive. The Lyme test comes back positive, the doctor says, well, it wasn't Lyme, don't worry about it. That's exactly wrong. And so that's a big problem in Lyme culture right now. But getting past that, so I think we did do a Lyme test on you, didn't we?
Yep, it was positive.
It was positive. So we started a really comprehensive functional medicine treatment plan, which is not just here's your prescription for antibiotics. This is not.
I didn't even take antibiotics.
Right. This is not like treating pneumonia or the flu or or an otitis media, ear infection. This is a much different animal. And for most people who get Lyme disease, they actually just get over it on their own. They get infected, they get what they think is the summer flu. Why would you get the flu in the summertime, right? If you live in a Lyme endemic area and you have what you think is the summer flu, make sure it's not Lyme disease. And, most people just fight it off, so that's fine. That's great. But then there's the rest of us mere mortals, and we get sick. Who's saying what down here? Chantel, hello.
Hi.
So what did we do? Well, you were already on a real crunchy diet, and so we didn't have to do a lot with that. But we start with the 5 modifiable lifestyle factors, right? I mean, I'm not kidding. But we start with the 5 modifiable lifestyle factors. So, crappy sleep. Got to do something. Got to fix it. Got to fix the sleep. Whatever it takes, right? So we prescribe some stuff. It either works or it doesn't. If it doesn't, we do something else. If it works, great. If it doesn't, we do something else. And we get to a place where people are getting restorative sleep. That's critical. Okay? Movement. Well, people with chronic Lyme often can barely get to the bathroom, right? They're really suffering. But we want to get them moving a little bit. So a walk, even if that walk is just the length of the house, a little bit of movement, and a little bit of outdoors. A lot of people with chronic illness of any kind, they're just stuck indoors. And that does nothing good for your psyche. So we got to get you at least outdoors. I mentioned the other day, there's actually really good studies on this idea of forest bathing, which we did today.
Yeah.
It was awesome. Even your 6-year-old was talking about how
he was a trooper, yeah.
And he was hugging everybody.
Miles on the trails.
Good thing we didn't run into too many people because he was hugging everybody in sight, meaning family members.
Yeah.
He was so happy and everything was so great. But anyway, so some kind of movement, getting outdoors, getting those pheromones from the plants and trees around us, really important. And the nutrition. When you feel crappy, man, is it hard to do the hard work, right? To get into the kitchen and do the prep and do all the hard things. But at a minimum, frozen vegetables, right? Frozen vegetables are doable. You can boil them, you can stir fry them, you can roast them, you can do a lot of things with them. So you got to get something going with nutrition. And then stress management. Boy, there are very few things that are more isolating and more stressful than a chronic illness. So we got to get a practice going, and that practice, whether it's prayer or meditation or whatever spins your beanie, we got to figure it out. And there's 1,000,002 ways to manage stress, and sometimes it's the 1,000,002nd one that actually you grab onto and work. So we just have to move through them. It's just like when we're talking about sleep. You got to just find what works for you. I have one patient who just couldn't get into exercise at all, but she found that she could sit on an exercise bike and slowly turn the wheels, and that just kept her mind occupied enough that it actually became meditative for her. So she was actually doing a little tiny bit of movement and meditative activity all at once, which is perfectly fine. It was great. And go ahead.
No, and these lifestyle factors are so important because as soon as I start slipping on a couple of them for a prolonged period of time, my symptoms start to return. Yeah. So if we don't do the work of changing our lifestyle habits, it doesn't matter what treatment we go through, we're going to end up back where we started.
Yeah, that's critically important. Yeah. Yep. So then we start with a functional medicine assessment. So the 5 modifiable lifestyle factors, that's just the base, right? And then there are these 10 other areas that we look at, ranging from digestion and absorption to immune function to energy production. Energy production is how you convert your food into energy. There's little things inside of all of our cells called mitochondria that convert our food into ATP, and ATP is a molecule that is the currency of energy in our body. And then how do we detoxify, and how do we communicate, meaning hormones and neurotransmitters, and how do we how's our musculoskeletal and structural system. And then another super important piece that is really not thought of a lot in many other systems of medicine, and that is mental, emotional, and spiritual domains of wellness. So we assess all of those, and we have tools to assess all of those things. We use for the gut, I use something called a GIFX, or GI function test, which looks at biochemistry going on in the gut, inflammation markers of different bugs growing, and blah, blah, blah. I do a test called an organic acid profile, and these are tests that we can do without sending you to a lab because of the COVID situation and the difficulties associated with being out and about. Yeah. By the way, I got new glasses. I only bought Presto Changeo glasses, so I'm getting really dark here. That was a mistake. I need to get a pair that aren't Presto Changeo for these kinds of things, because I'm really not a beatnik, although I kind of like that idea of being a beatnik. Anyway, and this organic acid profile is just a urine test, but what it does for us is it measures how efficiently. So it's not measuring deficiency. It's really uncommon for people to have deficiencies, but it's very common for people to have inefficiencies of their nutritional biochemistry. So we look for how efficiently you use vitamins and minerals and amino acids and fatty acids and antioxidants and heavy metals and nutritional metals. So heavy metals like lead and mercury and stuff. So as an example, we live in Minnesota. Pristine. I mean, look, it's beautiful, right? Except it's a mining state. And there's a divide in northern Minnesota called the Laurentian Divide. If you're on the north side of the Laurentian Divide, all your pollutants go into Hudson Bay. If you're on the southern side of the Laurentian Divide, they come south towards us. And the health department in the state of Minnesota tells us not to eat fish more than once a week if you're not pregnant, or if you're of childbearing age or a child, you probably shouldn't eat it more than about once a month, certain fish. That's because of mercury contamination. Unfortunately, heavy metals are everywhere. They're everywhere because of the semiconductor industry. They're everywhere because of industrial practices and mining practices and so on. Heavy metals are poisonous. And while it's true that you probably don't have a, quote, poisonous amount in your body, any amount interferes with your metabolism. So looking carefully for heavy metals and getting rid of them helps your metabolism work. It's like oiling your hinges. They don't squeak anymore, right? If you don't oil the hinges, pretty soon it's really hard to move the door. Yeah, and it blocks our ability to absorb the vitamins and minerals that we need. Yep. And so there's we may look at neurotransmitter tests. I don't know if I mentioned neurotransmitters, but the test looks at neurotransmitters as well. And then there's other tests we can do. Those are just 2 tests I do commonly. So then we start tuning all that stuff up, right? We get your digestion and absorption going, because there's this thing called the microbiome. And if the microbiome isn't really humming well, your immune system isn't humming well. when we're looking at the immune system. There's all parts of the immune system, and they have to work synergistically and interlocking. And if they aren't, well, we need to deal with that. We need to get Th2 and Th1 balanced, and we need to get the complement system and figure out if it's working and not working. So the innate and the adaptive and Th1 and Th2 and all these different pieces. And then energy. It's really common for us to see people with very inefficient energy production. Now, think about that. If you're not able to turn your food into energy, you can't do anything efficiently. So there's like the world's biggest party barge just went by behind us. So, if you don't have energy, you can't make hormones, you can't make neurotransmitters, you can't make antibodies, you can't repair your tissues. So that's critically important. So we go all the way around here, and then we start asking about your mental state, because we know that the mental state is one of the most important attributes for a robust immune response. And what about your psychosocial, spiritual state? These are all really impactful. And then, of course, we think about how do we kill the friggin' bug, right? And there are many ways to do that. Obviously, getting your immune system and your energy metabolism and everything humming is one way. Because, as I said before, most people just fight this thing off by their own, on their own. And if they don't, what's going on here that makes it not work?
Right, and there's a point, too, where we want to get people's wellness up enough that you can sustain the treatment.
Yep, without all the noise, without all the stuff. But there are many herbs that actually have been shown to work as well or better than antibiotics, at least in vitro. And so, vitro means in test tube, sorry. So, or in a petri dish or whatever you want to say. So, we use something called biocidin, and I use the liposomal fraction of biocidin, so it gets into the body and into your brain. We use stevia, the sweetener, the sweet herb or sweet leaf, it's called stevia, actually kills Borrelia better than certain antibiotics. And we use berberine, and we use oregano.
Silver.
I meant to say, we do use oregano, but I meant to say, I can't think of it. I got a giant bottle of it, though. That's funny how your brain just lets things go. And we use colloidal silver and other things as well. So there are many things that we can use that that will balance your system and then kill the bug. And we do this kind of yes and simultaneously. It's not do this and then do this and then do this, because that would take 102 years. And later on, we'll talk about some of the specific things we do, like we use a process called low-dose immunotherapy, which is very effective at late stage, middle and late stage Lyme. If you have acute Lyme, you need to kill the bugs. But in late Lyme, you may not even have any bugs left. You may just have a trained immune system to be hyper-responsive. So we'll be talking about that probably on Wednesday. And then we'll talk on Friday. We'll just continue that conversation. So we'll be doing this Monday, today, Wednesday, Friday, and talking more and more about Lyme disease and our approach to Lyme disease. And then, I don't know. You guys tell us what you want to hear about in the following week. But let us know if you have any questions, because I've been rambling on here way too long. And or what do you have to add? Tell us about your journey a little bit. So we got to the point where you figured out you had Lyme disease, and then we just dropped you like a rock. What happened next?
Yeah, I was sustaining right up until the point when we started treatment, and then with many people, when you start on the treatment regimen, it's not uncommon to go backwards for the first 3 months.
It's called a Herxheimer reaction. It's actually the bugs dying and releasing endotoxins into your system, and they make you feel like you have a flu.
They're inflammatory. So, the first 3 months, actually, my symptoms got quite a bit worse. And then slowly, usually when someone comes into the clinic, you use a system of, so rate your wellness on a scale of 1 to 10, and 10 is optimal wellness. So let's say, I started off around a 5 when I was starting treatment, and then I went downwards to a 2 to a 3.
That'd be pretty typical.
And then, every 3 months, you can only expect to grow about 1 point on that scale. So, when you think about it, it's not like I'm going to have, go about getting treated for this and then, or with any chronic illness, and then it's better. It took you a long time to get there. So it is going to take you time to get back. And, I think it took me a good year until I was like an 8 out of 10. So, it is...
Which is pretty typical.
Mm-hmm. It is typical. And, it can be discouraging, too, because, you finally figured it out, you just want to get better, and yet you're getting worse, and it's frustrating and long. But that's why typically patients see Dr. Sult about every 3 months is a check-in. Just to kind of review everything that you're going over. Is it
or
working?
Maybe more often, depending on the details, but yeah.
Yeah, sometimes.
So, Kathy, we'll get to your question in just a second. It's really frustrating, and it's really important to keep in mind, and that's why every time I see people, I remind them about this 1 every 3 months. And if you get more than 1, I'm not going to take it away from you. It's yours. You get to keep it. But don't be frustrated. And if you're not getting better, then the question is, why not? What did we miss? What did we not think through? What do we need to consider? What new tests do we need to do? It's never, here's your treatment, go home. It's every single time, let's figure out, if you're getting better, and you're getting better at least 1 every 3 months, then okay, let's let you keep going. But let's also think, where are you not getting better, and what can we do to hopefully enhance that? What else can we be doing? And it can be overwhelming. So, sometimes people say, but uncle, I can't do anymore. Or some people say, I can't afford one more thing, but what else should I do? And then we have to have a conversation about, well, what do you really mean by that? Can you test for Lyme disease, Kathy asked. Yes, you can. There are a number of tests for Lyme. The thing about Lyme disease is, if you've ever been like in a big city where there's a construction area and there's a fence around it, right? The only way we can really look at Lyme disease is by peeking through the little knot holes in the fence. So some tests look through this peephole, other tests look through that peephole, and some tests look on the other side completely from this direction. And so we do different tests for different reasons. We might do an antibody test called a Western blot test, looking for different parts of the bug in your blood, or different parts of the antibodies or parts of the bug. We might do tests of your immune system to see if your immune system is activated in a way that makes us believe that there's a problem with that is likely Lyme, not necessarily diagnostic of, but likely Lyme. And let's see, there's another question here. Do you have flare-ups with Lyme like other autoimmune diseases? You can. The goal, of course, is to be rid of your Lyme. And if we get favorable early investigations and treatment, usually that happens. Unfortunately, I often see people who've been sick for decades, and it can be much more challenging to get people completely well. And those people often do have recurrences, and we need to manage it. And sometimes, so here's the problem, is the Lyme bug living in your body and suddenly blooms out of nowhere? Or do you still live in a Lyme endemic area and you just get reinfected? That's the controversy, and nobody knows the answer.
Or is it just your immune system going back into that kind of hyper-aware state, which is where I think I fall into. I think that I just kind of teeter on that line of when I have a flare-up, that it's just my immune system being hyper-responsive.
Many people with chronic Lyme are people who are maybe kind of on the type A end of the spectrum, and pushed maybe harder than they should have. And this becomes a life lesson, and they find that suddenly they got to get their sleep, they got to get their rest, they got to maintain their stress management, they got to eat well, and if they don't, they crash and burn. And they're not necessarily getting Lyme back, but their system just can't sustain what they used to sustain.
Yeah. You know, it's a great accountability partner, because if I don't stay somewhat on track, I mean, I can have my, cheat days, and I like to enjoy certain things, but if I don't stay on track, my life lets me know. My body will let me know.
Yeah. And Chantel wants to know, what labs are you using? So I use a couple of different labs, but there's a gigantic, beautiful bumblebee. One of those bumblebees about that big, black and white, just like a kid's drawing. Anyway, I use IGeneX Laboratory. Now, if you get a standard lab from your regular doctor, your primary care doctor, and it's a standard Western blot and it's positive, well, it's positive. We don't need to do another test. On the other hand, if it's negative, we need to look harder. And I interpret an IGeneX test. There's other tests that we do as well, but this is sort of the first tier. The way I view it is, we could either, spend all of your money on the first day, which is a bad idea, or we can do the logical steps, right, and then stop when we get it. So, your primary care doctor did a Lyme test and was positive. Done. Don't need any more. Okay, but that wasn't positive. So then you come to me and I do an IGeneX. I do their standard Western blot. It's a more comprehensive Western blot than you'll get from your regular doctor. And I interpret it a little bit differently. So it'll look at IgG and IgM. Those are two different kinds of antibodies. And basically, I think that if there are two unique bands on that test among IgG and IgM, that makes me highly suspicious. And then if you have an appropriate story, and if other labs are also suggestive, then that convinces me. So in the setting of the right story, in the setting of other immune modulator kinds of laboratories, that convinces me. If that isn't the case, well, then we can do a Lyme blot test. And that's another layer up, and it's, these things kind of get more and more expensive, but we need to get a diagnosis. And sometimes, that's my newfie. Somebody's doing something. What are you doing, you big jerk? Anyway, sometimes it's just a good story, and that's all you need. According to the International Lyme and Associated Disease Society, Lyme disease is a diagnosis of exclusion and from history. So I hope, if that didn't answer the question, speak up there. Let's see, what's Kathy have to say? What symptoms do you have that make you think it might be Lyme, and what is a flare-up? Are you talking to her? Like, what symptoms do you have? You don't have too many symptoms anymore, do you?
No. Well, I do notice, for me, a big one is brain fog. Sorry if you're having a hard time hearing us, because the dogs are going crazy. So, brain fog. Difficulty sleeping. I'll have bouts of muscle pain. With Lyme, a lot of times I had foot pain, so the bottoms of my feet would hurt to the point it was even hard to walk. Vertigo, just overall inflammation.
So typically a patient with Lyme disease will have unrelenting, life-altering fatigue. They will have roving joint pains, meaning joint pains that move around. Like the knee hurts so bad you can hardly walk. And then 3 days later, knee's fine. But now my shoulder's starting to hurt, and 2 days later, my shoulder hurts so bad I can hardly use it, and so on. And it might be joints, it might be muscles. They often have brain fog and cognitive inabilities. So short-term memory can be a real big problem. And then also, sometimes people just get incredibly confused, like staring at a light switch to try to remember how it works, confused. I mean, seriously confused. So, but the other thing is, Lyme disease is also known as the great masquerader, because if you have a weird symptom, it could probably be Lyme disease.
Or it could probably be something else too.
Yeah, right.
So
that's why I say disease, diagnosis of exclusion. You know, you don't want to just go to some guy who says everybody on earth has Lyme disease. You want somebody who's going to take your symptoms seriously and try to get to the bottom of them. And if you've got some weird brain thing going on, you probably need to have your head scanned. You know, we need to make sure you're not having vascular problems in your head.
Right.
You know, or an EEG if you seem to be having like absence seizures or something. So you really need to go to somebody who's going to take your symptoms seriously and try to understand what your symptoms are, not just say, oh, everybody's got Lyme, we're going to treat you for Lyme.
And a lot of the symptoms lead into the other symptoms. So fatigue is huge, but I also have difficulty sleeping. So am I fatigued because I can't sleep at night, or is, you know, the Lyme causing me to is it interrupting my sleep cycles? So it's you know, it's really hard to pinpoint exactly one thing, where it's more of a collection of things.
Yeah, that's very true. Bridget, Sanford and Mayo Clinic, great places, you know, for what they do, but they do acute care medicine. And you know, you're asking how can you get them to use a different lab? You can't. They got their protocols. They're going to do it their way. And unfortunately, that's just the way it's going to be. If you want some other kind of care, you have to see somebody who does a different kind of care. Mayo Clinic is the pinnacle of the mainstream allopathic care. They're excellent at it. If you've been if you have cancer or a heart attack or have been in a car accident, you would love to be in the Mayo Clinic emergency room. If you've got chronic Lyme symptoms, and maybe that's not the place you necessarily want to be, unfortunately. So unfortunately, they're really, really excellent at what they do, but might not be the best place for other kinds of problems. Well, you're welcome, Kathy. And any other questions about Lyme disease? What are these guys barking at? Otso is right on the shoreline back there, just barking his head off at probably somebody fishing or something. Probably has a dog over there or somebody's. They never bark. They never bark, of course, unless we get on.
No, they're usually lazy and they're laying down.
Till we're on air here. Yeah. Okay, so that's the beginning of Lyme. I think we're going to talk maybe about low-dose immunotherapy and how it increases tolerance to the Lyme bug, which allows your immune system to then focus on the antimicrobial aspects instead of getting bogged down in these sort of side symptoms, and how LDI can really help people with chronic Lyme disease.
Or with a lot of different
things, right? Not just
infections or.
Yep, allergies, any autoimmune process. Yeah, it's a very interesting, kind of like allergy therapy, except much more dilute, and we'll talk about that and what that means.
Yeah.
All right, any other questions? Let us know. Looks like there is one hiding down there. Kim.
Okay.
Yeah, you're going to have to read that.
I'll read it if I can. Okay. Hello, Dr. Sult. This is Mike Thomas. Remember me? You diagnosed me with Lyme. 3 years of bee venom therapy. It's gone.
Oh, yeah. Awesome. Bee venom therapy. Yeah, that's not something I do, but I had a number of patients who did it. It's gone. Oh, that's so awesome. I am so excited to hear that, and it's great to hear from you. That's awesome. Rheumatologist tested me for Lyme without my knowledge. Oh, Bridget. Yeah, well, they often will do a whole battery of tests trying to figure out what's going on. And of course, if the standard Western blot is negative, you're primary care doctor, rheumatologist, primary allopathic people will say, well, you don't have Lyme. The test was negative. And that's the mainstream belief, but the International Lyme and Associated Disease Society has a different opinion about that. Yeah. All right. Anything else?
Nope, not for today.
All right. So we'll see you Wednesday at 7 p.m. Central Time. We'll talk about LDI and its many faces. All right. Have a great night. Thanks for showing up, everybody. It's great to see you here in these times of social isolation, where we only see the same 5 faces all day long, every day. Yeah.
Hope you're enjoying your Memorial Day.
Yeah. Who is saying what here? Oh. Well, thank you, Kim. That's nice. All righty. Good night.
Bye.
Bye.